There are things about nursing university that nobody talks about. I'm a fourth year nursing student as well as I'm a final year nursing student, and now I'm gonna give you the stuff or the tips or the knowledge that nobody talks about, but it's extremely important to learn, or at least to know. The first one is you will feel overwhelmed, and it's normal, especially in the first few years in nursing university. I'll say it's not a hidden truth, if you could say. It's a known truth about nursing university. It's one of the hardest universities out there. There is a lot of stress, there is a lot of hours that you need to spend, and as well as there is internship, there is lectures, there is all of these different aspects that you have to sort of care about and take care of, which definitely you will feel overwhelmed. Let alone you have a personal life, you could have a social life, etc., which just absolutely increase you getting or being overwhelmed. Now, this is especially true if you're a first year, second year, especially the first few years. It's pretty hard and it's pretty overwhelming because you haven't gotten used to the system, you haven't gotten used to the medical terms, you haven't got used to environment or internships. Internships really kicks in the second year, right? And depends on obviously the formation. As an example, for me, I study nursing in East of Morocco Nursing University. We have 1,200 hours of internship, which is quite a long time. But at first, it really does feel overwhelming. You're not used to the medical staff, you're not used to your team, you're not used to colleagues, you're not used to maybe the timings. Every day you have tasks, so that is something to keep in mind. Now, this is extremely important, as I said, for the first few years of nursing college. I'll say the second tip that you really wanna focus on is some topics are useless. Some topics are useless, but in real life. So a lot of theories and theoretical and lectures that you study are pretty much useless in real life. In real life meaning in real application, in internship, etc. A lot of the stuff that you will learn will be useless. Now, how to fix this is you always have to understand the concepts that you're studying. Let's say I'm studying a subject, it could be as vague as anatomy or it could be as specific as specialties. But what you want is understand the concepts first, then you go into the details. So the concepts will not only make you be able to understand whatever medical intervention is happening, chirurgical intervention is happening, what are the doctors talking about, the medical terms, etc. And also sometimes you just have to learn it so you understand what are the biggest precautions that you have to take care of the patients and what are the questions that you have to give that specific patient for his specific needs. Now, this is also important for you if obviously you really want to exceed in the internship. A lot of the times, what you find is you have to simplify your information. You have to simplify your knowledge. You have to simplify what you've got because not everyone understand or remember all of the details that you have studied. Not everyone will remember all of the details you have studied. So what you really want to know, or what you really want to do, is focus on the concepts, because a lot of the stuff that you study will not be useful, especially in internship. The third point I'll be talking about is nurses, not teachers, will teach you the most. So especially in internship and practical use and practical practice, literally it's practical. But especially in practice, especially in internships, nurses will give you the biggest, huge advantage overall. Teachers could give you a lot of advantage, but it's more in theory, it's more in lectures. But when it comes to real life application, nurses actually are what gives you the biggest and the most huge advantage and difference when it comes to your knowledge. Now, this also comes to experience. A lot of teachers in nursing university are not nurses by base, which is fine if we're talking about the economical aspects of the health system. It's fine if someone who is specified or specialized in economy to teach you that. But when it comes to more of the usual and casual aspects of of nursing, yeah, what you really want is nurses. Nurses will not only give you the biggest advantage, they will give you practical use, and sometimes there is stuff that you haven't seen in theory. It doesn't really exist, at least in the lectures and theories that you have studied, or the teacher didn't have time to explain it to you, or maybe you were not paying as much attention. The nurses will actually help you with that. Now the fourth point is your confidence will go up and go down. And this is really, really big, especially with internship again, as well as theory. So for internship, maybe at first you don't have the confidence. You're a bit scared. You don't have the confidence. You don't know if you should do this or you shouldn't do this, etc., etc. And that's totally fine. Then maybe you learn a couple things. Maybe you are used to that service, etc., and your confidence go up. Maybe then you change the service or you change the place or whatever happens, and then your confidence goes down. So really, your confidence goes down and up when it comes to nursing university. And that's something normal. That's something to actually look out for and just to expect, really, when it comes to nursing university. All right, I don't know if I should go on this road, honestly, but I would say, all right, fuck it, I'm gonna go. Now that's really important. Now let's move on to the fifth point that I'll be talking about is you will grow mentally stronger generally without noticing at all. So nursing university is quite tough. Good weather, huh? Nursing university is quite tough, and it will literally make you grow stronger mentally, whether when it comes to resilience, discipline, punctuality. You will learn how to be punctual every day, because obviously time and respecting time is a big thing when it comes to nursing, and is a big thing when it comes to nursing, internship, as well as lectures, as well as patients, because you have a lot of responsibilities in your hand, etc. So that is a really big thing, as well as obviously you need some resilience when it comes to your mind. And the main reason behind it is that you're dealing with patients that are sick, or patients that are really, I'd say, demotivated and depressed, really, when it comes because of their disease, because of their situationships. A lot of people are hospitalized for a very long period of time. So really, you don't expect them to have a utopia mind in their brain, like to think that everything is perfect and everything is good. In fact, it's going to be the absolute opposite. They will feel bad, they will obviously complain, etc. And that's literally your job, is to understand their complaints and understand their problems and try to fix that. And that's one of the biggest important things about obviously the nurses or the nursing diagnosis. Now, I would say as a sixth point that I will actually add, I would say because so one of the things that literally a lot of people don't talk about nursing college is just how hard it is, but also how much stature you will get from it. So hardship and status are usually intertwined and linked, and this is not an exception. Actually, internship is quite hard, and I would say a lot of people actually know how hard it is, especially the people who have nurses in their family, or nursing students in nursing university in their family, etc. They all have a good idea about how hard nursing is, so they all respect it in a way. They all will really give you the value if you are with family, if you are with friends, if you are outside. You always have this, some sort of respect that people give you, some honor that people give you. And I would say, as a good story, that I've actually learned this, because I never thought about this, especially at the beginning. If you're first year, second year, you're like, nursing is not as good. Maybe you compare it to some other medical fields. Maybe you compare it to med school, etc. A lot of people actually do that. But really, when you get used to it, you really get the benefits and the fruits you start harvesting, especially after the few years. So in the final years, you really get to do that. And that was one of the biggest or best impressions / interactions that I've got this year. It was actually in North Morocco. I was there in a vacation, and I've met also other people from France. They were on a vacation there in Spain, etc., from all around the world. And one of them was a doctor. She had a six-pack. She was ripped in this very like luxurious area, and she was asking me about, hey, like, what do you do? I said, I'm actually in nursing university. And she was speaking about how honorable it is, and it's one of the best things that happened to me. It's very good memory as well. Now, as a recap, first thing, you will feel overwhelmed. Obviously, a recap with this beautiful view. Let me show you the lake behind me there. But the first point is you will feel overwhelmed, and that's normal. Point number 2 is some topics are useless in your life, especially in internship. Point number 3, nurses, not teachers, will actually teach you the most, especially in internship. Number 4, your confidence will go up and down. That's pretty normal. Actually, you have to expect it, especially in the first few years. And 5, your mentality will go harder, will grow tougher, will grow stronger without you even noticing. And point number 6 is nursing. In nursing university, it's really hard, and that is one of the main reasons why it has a status. It has a very respectful and honorable place. Now, I want you to let me down below what's your biggest challenge with your nursing university, and I'll make sure I'll make a video on how to fix it. Thank you.